Yes, yes. In fact, some of them have had very good impacts and they have moved ahead. You know that Kenya is a malaria area, malaria is in the malaria zone. The coverage with the ITNs has been quite high. The uptake also very high, and the strategy was actually to give to pregnant women and children under 5. And this the malaria program has done very, very well. In many of the areas, even more than 80% coverage, both of ownership and use. When you go in the other area of element control, there's also a deworming program that is ongoing. And all these are all free supplies through the health system. So when the pregnant woman comes into the health facility, she is also given the deworming medicine. And through the health system, in terms of through the school facilities, the children are also dewormed. So when the children are also dewormed and the mothers are dewormed, then you eventually end up lowering the number of people who would potentially be having worms, and therefore you find the prevalence actually going down. We have the other strategy that we are looking at in terms of dietary diversity, and this we are doing closely with the Ministry of Agriculture in terms of improving the knowledge amongst the households so that they can produce diversified foods, especially the dark green vegetables and also the indigenous foods. They are very good as sources of iron, and use of fruits at the same time to make it bioavailable. So those are strategies we work with together with Ministry of Agriculture. And then within the ministry itself, we are scaling up food fortification of processed cereal flours, mainly maize, which is our staple food, and wheat. And now it is mandatory. So we are moving on with all those strategies to make sure that at least we can be able to prevent and control anemia within the population, and more so the vulnerable population of women and children. The integration actually is key because, as you know, with the nutrition, it's a multi-sectoral issue. It is not a one-sector issue. Either it is a poverty issue in one place, it's a food availability or access issue, it's not uptaking to the proper healthcare practices, it's a public health. So we actually are able to integrate through various policies. For example, now the food and nutrition security policy is integrated into one document. And through that, we have structures of engagement with the implementing line ministries, whereby we can be able to focus on one objective, but from different sectors. Those structures are both at the national level, and now as we are going into the county levels, we are now going to establish them at the county levels to make sure that when we are talking about for something like anemia, we are able to coordinate and talk to our public health colleagues who are carrying out malaria control, who are also carrying out deworming. And that is within the health sector. But at the same time, we are also engaging with other line ministries. Key is agriculture. And the engagement is through these structures that have been created by the framework of the National Food and Nutrition Security Policy. Challenges are there, yes, and the challenges, especially now as we are going into 47 counties, these are 47 different units with different capacities and different expertise. Definitely, that is an area that we require a lot of support so that we can bring everybody to the same page and they can collectively now be able to address at the operational level in a holistic manner. What we intend to do is that for any agricultural intervention, we have produced a toolkit where we have called it Agri-Nutrition Toolkit. And any agricultural worker can now be able to use that toolkit. As they are teaching agriculture, they are also teaching nutrition at the same time. We have come up with a module for training community health workers on nutrition, so that as community health workers are also carrying out their community-based activities, they have also integrated nutrition into those activities at the community level. Because when there is adequate demand, then the supply side actually will be able to respond very well.